what we offer in the ABC space. So you can see in the middle, we offer a fully integrated service as a CDMO in the ABC space. So we cover everything from antibody, payload linker production, bioconjugation and fill finish. So all or any of that supply chain can be supported by our teams. We've been operating in the ADC space for quite a long time. So as a CDMO, we've been in the business for nearly 18 years in ADCs. It's quite a long history. And in that time, we've racked up quite a track record in terms of the number of batches that we produce. So covering both commercial, clinical and non-clinical batches. So fairly good coverage between over 300 commercial batches at ABC from our bioconjugate site in the UK, and over 700 GMP clinical batches. And recently, we've just expanded our production capacity in the UK as well. So we've just opened our new manufacturing facility, which is more or less doubling our capacity for drug substance production here in the UK. We've just had a very, very successful regulatory audit of that site, and it's now fully operational. We're starting to make GMP batches of ABC there right now. They're underway. And for anyone who is maybe interested in the earlier stage development of ABCs, if you're looking for your first clinical batches, we have a program specifically tailored to meet those needs, which we call Accelerate, and we'll be happy to speak to you about that if that's of interest. And maybe just to put a little bit of colour on it, so we can cover pretty much everything across the development life cycle in ABC, be that support that you may need at preclinical stage, at clinical manufacture stage, or at commercial manufacture stage. So we can do everything from small-scale material supply, FTA agreements, and supporting developability assessments and analytics, through to clinical and commercial manufacture, and of course all of the requirements around that, to take you through from full development of your process and analytics to manufacture. So that's enough about ourselves, and maybe let's talk a little bit more about ABCs and the specifics around formulation for them. So in terms of ABCs and formulation, I guess one of the key things you need to think about is developability. So you've probably got to think about it fairly early once you have a lead candidate identified. You want to make sure that that molecule is it's stable, that it can be manufactured well, and you're not going to see any problems with it as you go through the development stage. I guess anyone who's ever worked with anything protein, so be that an antibody, an enzyme, a different type of protein, will probably know that the formulation that you choose for doing maybe your enzymatic reaction or your purification of your protein can have a fairly big effect on the stability of that protein. So tweaking the pH, tweaking the buffer, the concentration that you're using, can go from having maximum activity, great solubility, to having a little pellet of gunk at the bottom of your vial that does nothing for you, right? So it's pretty important to get your formulation right. And obviously, from a physical and chemical stability perspective, that's what you're looking to maximize in a sense when you're developing a formulation for your ABC. And the intention of that being, I guess, hopefully that you have good shelf life for that ABC in the end.